Everybody, and welcome to today's webinar. This is being hosted by ISSUP Kazakhstan and ISSUP Greece, two of our national chapters who have collaborated to share the results of a survey on the topic of alcohol use amongst adults in their respective countries. My name is Kirsty Fitzpatrick, a National Chapters Coordinator for ISSUP. I'm also joined by Olha Myshak-Kipsiska, my fellow ISSUP colleague, who is the National Chapters Coordinator for Asia and Ukraine, as well as our speakers from Kazakhstan and Greece, who I will introduce shortly. Today, we will highlight key findings from each country and briefly discuss how the data can support the planning of prevention efforts. The session will also touch on recent trends in alcohol use and the importance of local research in addressing public health challenges. This will be followed by a Q&A session, which will be managed by Olha. Whilst we are waiting for a few more to join us, I will begin by saying a little bit about us. So, ISSUP is an international network that unites, connects and shares knowledge across the substance use prevention, treatment and recovery workforce. Our global mission is to make the work of our members as effective as possible. We do this by making it easier to discover and share knowledge, training and networking opportunities. We currently have over 45,000 members in more than 200 countries and territories and 39 chapters across the globe. If you've not done so already, please head over to the website www.issup.net, where you will find information on how to sign up for free membership. The website also has a wealth of resources and publications for you to check out. Before we get started, I'd like to go over a few more things so you know how to participate in today's event. You will have the opportunity to submit text questions to our presenters by typing your questions into the questions pane of the webinar interface on your screen. You may send in your questions at any time during the presentations, and we will collect these and address them during the Q&A session at the end of today's webinar. A recording will also be made available for you to watch on demand after the event, and I hope you will stay with us for what promises to be an interesting insight into alcohol use in Greece and Kazakhstan. And it'll also show you how to be able to recognise the value of local research in shaping effective prevention strategies. Now then, down to business. I'd like to introduce you to our speakers. Thanks for coming on today. It's great to see you both. So our first speaker is Nadezhda Chechenko. She's a psychiatrist, and since 2020, she has worked for the Republican Scientific and Practical Center of Mental Health in Kazakhstan. She has a PhD in public health and is a coordinator of the national chapter. Our second speaker will be Natalia Zakhartsi. She is the Scientific Director of the Centers for the Prevention of Addictions and the Promotion of Psychosocial Health, Sirius, in Greece. She graduated from the University of Lincolnshire and Humberside Whole Campus in the UK in 2004, receiving a BA Honours in Social Work. In 2020, she received an MSc in Criminal Law and Addictions from the Aristotle University of Thessaloniki with honours. Natalia is also the coordinator for the ISSUP Greece chapter. So I'd like to hand over to Nadezhda for the first presentation. The floor is yours. Thank you.
Thank you. Thank you, Kirsty. Let me share my screen. Yes. Is it okay with my presentation?
Yes.
Yes. Perfect. So, good afternoon, dear colleagues and participants of our webinar. Today, I'll present the key findings from our joint project with ISSUP Greece, which aim to assess patterns of alcohol consumption in our countries using the audit screening tool. Let me begin with a brief overview of Kazakhstan. It is the 9th largest country in the world and the largest landlocked country globally, stretching across both Europe and Asia. The total population of the country is estimated at 20.7 million people. The gender distribution is fairly balanced with 51.3% female and 48.7% male. Over the past year, our population grew by 1.3%. The median age of the population is 29.7 years, indicating a quite young demographic profile. The overall literacy rate among adults aged 15 and above is 99.8%. 58.5% of people in Kazakhstan live in urban areas, while the population density remains quite low at 7.7 people per square kilometer. So this image shows official data from the World Health Organization on total alcohol consumption per capita age 15 plus, measured in liters of pure alcohol per year. The blue line represents the average total alcohol consumption in Greece for adults aged 15 and older. The data shows a steady decline from around 9 liters per person in the early 2000s to 7 liters in 2022. This visualization illustrates that alcohol consumption in Greece has declined significantly over the last 2 decades. Greece is in the moderate consumption group globally. What about Kazakhstan? So these key observations just from 2000 to 2022 also. As you can see from this line graph, consumption has not been static. From 2000 to the mid-2010s and 15s, Kazakhstan saw increasing per capita alcohol consumption, starting around 3.8 liters and increasing to 4.5 liters in 2015. However, consumption has notably increased since the late 2017, reaching approximately 5.4 in 2022. While Kazakhstan's consumption is not among the highest globally, it's also not among the lowest, placing also in a moderate category. The recent increase warrants attention for our public health implications. A recent pilot research conducted across the 5 primary healthcare centers in Kazakhstan confirms that alcohol screening and brief intervention is feasible and effective in real-world clinical practice. Of more than 7,300 patients eligible for the study, nearly 16 were screened, of whom 12% were found to have risky alcohol use. Following 3 months, the early intervention group saw a decline in positive ODC results to 50%, compared to 58% in the control group. This confirms the need for structuring screening, early intervention, and expanded access to treatment. Kazakhstan has a national registry for individuals with alcohol or drug use disorders. While it ensures free medical care, many people avoid seeking help due to stigma, fears of confidentiality breaches, or social consequences. This is a critical barrier, and we must address it in future public health strategies. The left bar, primary incidence of alcohol-related disorders, illustrates that in comparison for the years 2023, blue bars, and 2024, orange bars. There is significant regional disparity in the incidence of alcohol-related disorders across Kazakhstan. The data reveals dynamic shifts, with some regions experiencing concerning increases in new cases, while others show positive trends of reduction between 2023 and 24. The data highlights a critical public health challenge in Kazakhstan. While the overall national incidence shows a slight decrease, the significant increases in some regions warrant immediate attention. For example, Pavlodar and Abai regions are particularly concerning due to their high and rapidly increasing primary incidence of alcohol-related disorders. These areas may require targeted intervention programs, increased resources for prevention, treatment, and rehabilitation of alcohol-related disorders. The right bar chart absolute numbers of alcohol-induced mental and behavioral disorders. Similar to the previous chart, there are distinct shifts in the absolute number of cases between 2023 and 2024 for many regions, indicated dynamic changes in the total number of people affected. Overall, the data underscores the ongoing challenge of alcohol-induced mental and behavioral disorders across Kazakhstan, which varying regional trends impacting the public health landscape. And based on observed trends in both countries, the primary incidence and absolute burden of alcohol-related disorders across our regions, we recognize the pressing need to better understand patterns of alcohol consumption within our population. Therefore, the aim of our study was to evaluate the prevalence of hazardous and harmful drinking using the full audit questionnaire. The sample included adults from different regions and backgrounds. Data was collected anonymously. This project was conducted with ethics committee approval and cultural adaptation of the assessment tool. So here, this slide provides an overview of the characteristic of the study participants. The data is based on 1,871 completed audit forms. Our respondents included a wide range of age groups, educational levels, and employment statuses, providing a balanced view of alcohol use across the country. On the left side, there is an explanatory text in Kazakh and Russian about the study's background, methodology, and ethical considerations. The audit scoring system ranged from 0 to 40. Scores of 8 or above suggest hazardous use, while scores 15 or more indicate likely alcohol use disorder. The majority of our respondents, approximately 80%, engage in low-risk alcohol consumption. This is a positive finding, suggesting that for a large segment of the population, general public health campaigns focusing on maintaining healthy habits are appropriate. But despite the large low-risk group, approximately 200 individuals, around 10% of the sample, were engaged in hazardous or harmful drinking or showed signs of alcohol use disorder. Our findings reveal moderately strong negative correlation between sex and alcohol use, consistently showing that men tend to consume alcohol more frequently and in larger quantities than women. This powerful association mirrors global trends in alcohol consumption patterns. Other factors like age, place of residence, city or village, education or income didn't influence significantly on level or frequency of alcohol use. Although people with higher education and income sometimes drink a bit more frequently, perhaps it's because it's more social acceptable in their circles. This slide illustrates the critical link between drinking patterns and their negative consequences. We examined two key behaviors: drinking frequency and consuming 6 or more alcohol units in a single occasion. Our analysis clearly shows that both increased drinking frequency and episode of heavy drinking are strongly associated with a rise on various negative outcomes. These include personal impacts like hangovers, guilt feelings, and memory blackouts, as well as social and behavioral consequences such as neglecting duties, injuries, and concerns raised by others. Notably, feelings of guilt, memory blackouts, and concern from others consistently show the strongest positive correlation with both patterns of alcohol use. This emphasized the significant psychosocial and behavioral toll that certain drinking habits can take. These findings underscore that both how often and how much one drinks are strong predictors of adverse consequences, reinforcing the need for comprehensive public health strategies addressing both regular consumption habits and heavy episodic drinking. In light of this finding, it's crucial to strengthen both prevention and access to care for those already affected. So where can people in Kazakhstan turn for help? Our Republican Scientific and Practical Center of Mental Health acts as a national coordinator body for addiction services. It provides evidence-based treatment, prevention, and supports regional mental health centers across the country. Primary healthcare providers play a growing role in early detection through screening and brief interventions. For those who are afraid of stigma or registration, there are anonymous hotlines and online consultations, allowing people to seek guidance confidentially. In all cases, the earlier the intervention, the better the outcomes. This, my final slide, powerfully shifts our focus to the crucial role of family involvement in substance use prevention and rehabilitation. We have cross-country study, and our study highlights the important role of families in addressing problems related to substance use disorders. The study aimed to understand the influence of substance use on family members and the extent of their involvement in interventions. And the Universal Prevention Curriculum Family Training. This is a vital program designed to equip managers and supervisors with the specialized skills needed to effectively integrate families into comprehensive prevention strategies. This course is important for truly understanding and implementing effective family-based prevention by focusing on family engagement. Initiatives like UPC Family Course aim to build a more holistic and effective public health response. And in conclusion of our joint survey confirms that risky drinking behaviors widespread and that their social and psychological consequences are significant. But we also see opportunities. We know that screening works, brief interventions are effective, and care is available. Let us work together to ensure that people can access support without fear and that health systems are ready to respond. Thank you for your attention.
Thank you, Nadessa. That was really interesting. So thank you very much for that. As a reminder, just while we're halfway through, please continue to send your questions in via the questions pane, and we will answer them at the end of the session. But now I'd like to hand over to Natalia Zakatsi from ISSUP Greece for her presentation. So the floor is yours, Natalia.
Thank you. Let me share my screen. Is it okay? Can you see my screen?
Yes.
Okay, that's great. Well, welcome everybody, and thank you for joining this webinar. I'm going to start by profiling a little bit of my country, Greece. Our total population is of nearly 10 million people. The female population is slightly bigger than the male population. Our median age of the population is a lot older than Kazakhstan, as you can see, is 45.6 years. The urban population is nearly 80%, a bit more than 80%, whereas the literacy of the population from people that are aged 15 plus is over 90%. Greece is a fairly small country. It ranks 95th as a 95th country in the world in terms of area, land area and population, and geographically it's set on the crossroads from Europe, Asia, and Africa. I'm going to show you the key findings from our 2024 ISSUP survey regarding alcohol use among 15 and 16-year-old students in Greece. And we're going to compare it a bit with the 2019 results of the same survey. As you can see, 92% of Greek teens reported that obtaining alcohol is very easy, well above the ISSUP average, that is around 78%, and we are amongst the highest in Europe. Nearly 75% of students consumed alcohol in the last 30 days versus the European average, which is 48%, so we're well way above that. In terms of what we call binge drinking and intoxication, heavy episodic drinking, which is 5+ drinks at once in the past month, is slightly above the EU average, which is nearly to 35%. And Greece's rate is on par or marginally higher than that. Contrarily, intoxication in the last month is amongst the lowest in Europe, with Greece falling into the group of countries with less than 10% reported drunkenness. Greece, in this, as we can see, Greece shows exceptionally high access and frequent alcohol use, but relatively lower rates of drunkenness, indicating more moderate consumption habits. Drinking amongst the Greek teens is deeply normalized, with easy availability and common usage. However, the lower intoxication rates suggest that while many teens drink, fewer overindulge frequently. The combination points towards a culture of regular but moderate consumption rather than an acute binge-centric behavior. If we compare the results with look at the green table, if we compare the results with the 2019 ISSUP research, we can see that more students are drinking regularly in 2024 than in 2019, reversing previous EU-wide trends of declining youth alcohol use. The last month drinking rate jumped by over 10 percentage points, suggesting a cultural reinforcement of normalized drinking. Binge drinking and drunkenness slightly decreased or are stabilized, and this hints that a more frequent but controlled drinking pattern, possibly influenced by our Mediterranean social norms. For example, we're drinking at meals, parties. We've got these gatherings and like villages, or during the summer that people are partying. So this is quite a cultural thing. We, as Nadezhda said before, ISSUP Greece and ISSUP Kazakhstan decided to use the audit questionnaire. In Greece, 547 adults completed the form. The distribution was done through the social media platforms. The instrument was an online full audit form adapted for Greece. What we were trying to establish is the prevalence of hazardous and harmful drinking, and our aim was to study the need for developing prevention interventions on alcohol use. And you can see the questionnaire there. So around 72% of the people that responded were women. The age range was fairly distributed through 25 to 60 plus. The alcohol preference is clearly wine, the alcohol of preference. As you can see, 42% have a drink containing alcohol 2 to 4 times a month, 23% monthly or less, and 24% 2 to 3 times a week. The standard drinks containing alcohol on a typical day, the vast majority has 1 to 2 drinks. 6 or more drinks in one occasion. The vast majority says that they never engage in this behavior, whereas 25% is reporting less than a month. In the question of how often during the past year have you found that you were not able to stop drinking, the vast majority says never, whereas 17.4 reports that less than monthly. During the past year, the people that failed to do what they were expected to do because of drinking, the vast majority says never, whereas 13.4 reports less than monthly. And during the past year, the people that needed a drink in the morning in order to function after a heavy drinking the previous day, the vast majority says never. The feeling of remorse that comes with heavy drinking, many people said, like the vast majority, again, nearly 70% said that they never had guilt or remorse after drinking, whereas 25.6% reported that it was done less than monthly. In terms of remembering what happened the night before because of drinking, 89% reports never, whereas 8.7% reports less than monthly. In terms of injuries as a result of drinking, the vast majority says that they have never been injured, whereas the 6.9%, nearly 7%, reports that they have been injured, but not in the past year. In terms of having someone in the family circle or friend circle or a doctor that has told them that they should cut drinking because they were concerned, the vast majority says that no one has ever done that to them, 87.2, whereas 9.3 report that someone has told them to cut down, but not in the past year. So, as Nadezhda said, we scored these findings, and 96% of the population that responded to our questionnaires clearly states that they're in low risk consumption. The score is from 1 to 7 points, whereas we have a 3.2% of hazardous or harmful alcohol consumption with a score from 8 to 14, and possible alcohol dependence, which is moderate to severe alcohol use disorder, is 0.8%. So, local research is very essential in shaping effective prevention strategies, as this is the way that we can ensure that interventions are based on a clear understanding of the specific needs, risks, and protective factors within a community. By grounding profession efforts in locally relevant data, we practitioners can design, adapt, and implement evidence-based approaches that are culturally appropriate, context-specific, and more likely to achieve sustainable outcomes. Based on that, 3.5% that scored medium and high as a medium or high risk group may seem like a very small percentage, but in reality, it reflects a significant public health concern. 3.5% prevalence of medium to high risk alcohol use, with 2.8 being between 18 and 29 years old, 20 years of age, shows that despite this being statistically moderate, the consequences are disproportionately large. Prevention interventions delay first use, cuts binge drinking by 30 to 40%, according to the reports of WHO, and strengthens protective factors and saves money, because we have to talk money. So the ISSUP research in 2024 showed us that 3 to 4% students aged between 15 and 16 reported behaviors aligning with medium to high risk alcohol use. 3.5 the 3.5% that we found in our research mirrors the ISSUP data, indicating that it's representative concerning the trend. So Nadezhda talked about the importance of developing family-based interventions regarding alcohol use Here I will add the strengthening of environmental and community prevention interventions, because as it seems in Greece, the high access rate requests large environmental preventions in order to at least for the beginning to lessen the access of children and young adults to alcohol. School-based prevention also is mandatory for all school settings, and obviously family, as Nadia said, because in general in prevention what we need to do is we need to strengthen all the protective factors regarding not only the micro level but also the macro level of children and young adults, which is family, school as a micro level, community, and in general of the environment as in a macro level. And I will close these remarks by stating that what the World Health Organization has said, that for every €1 spent in prevention, we save 4 to 7 euros in societal savings. And I will thank you very much. I will also ask you to join ISSUP Greece and join ISSUP in general. Thank you so much for this opportunity, and we're ready for your questions. Thank you very much.
Thank you, Natalia and Nadezhda. Kirsty, would you like just to tell something before? Yeah.
No, I'm good. I think we're just ready for the questions. I mean, they were brilliant presentations. Both, thank you very much for your time. Really interesting insights into each different country. And yeah, I think unless you've got anything to add, Olha, I think we can dive into the questions.
I would also like to thank you for sharing the results of your surveys and for providing such invaluable inputs. It is in general encouraging to hear that there is a trend toward reducing alcohol use in your countries. And as we have some time left, I can compare this with findings published in my own country, Ukraine, by the WHO, which also show a significant decline in alcohol consumption. And in 2024, it was around 25%. And you know that Ukraine is in war, and currently over the quarter of Ukrainians reported that they have reduced or stopped drinking alcohol since the beginning of the war of the full-scale invasion in 2022. And many of the Ukrainians support stricter regulation to further decrease alcohol use. So it would be in general interesting to conduct further studies and analysis to better understand the factors contributing to those trends. And we have a few questions that really following my remarks, and these first two questions are for both speakers. And are there laws that prohibit or limit the sale of alcohol to certain quantities? This is the first one. And the second, are these warning labels on alcohol beverages in both Kazakhstan and Greece?
The second question.
I didn't get the second question as well. Sorry.
So the second question was if there are some labels on alcohol beverages in Kazakhstan and Greece that, like, I don't know, maybe stop people from buying alcohol, I don't know, like a prevention measures.
Like an environmental prevention measure.
Yeah. Yeah. Can you please respond to that?
Yeah. Nadezhda, do you want to go first? Or? Whatever you want.
Okay, you can answer first.
Yes. So if I got the first question correctly, is that if there are laws that prohibit the access to young children and adults, I will say yes.
Yeah.
There are laws. the laws are children, well, not children, children are not allowed to buy alcohol. Somebody has to be 18 and over, so an adult. The problem with the law is that it's not being, the people don't abide by the law, and so they can get access. It's, I will say, in a societal context that many times parents here would send their kids to buy them alcohol or cigarettes or something. So that makes it even more hard for the person that sells them that to realize if it's for the children or if it's for the adults. So it's kind of a thing that happens here. I have to say, though, that in the last about 6 months, that law has been even more strict, and there has been people authorities that are checking mini markets and alcohol beverages stores if they abide by the law. So that has gone. That has strengthened the protective factor of access. So kids don't have as much access as they used to do, but it's not completely forbidden. So the problem is not that laws are not there. Laws are there, but we need to abide by them in order for it to work. And as for the second question, if I got it right, and please all help me with that, is that if on the labels there is a containing of alcohol or some messages about alcohol?
Yes, some messages. I think it's about messages.
No, we don't have messages against alcohol. The only thing that we have as an environmental prevention strategy is on cigarettes, where they have some pictures and some messages about how harmful that is.
Thank you, Natalia. Nadezhda, can you tell us more about Kazakhstan?
So I'll start with second answer, because in Kazakhstan the same situation. We have no any pictures or signs about harmful of alcohol consumption. And in Kazakhstan, alcohol permitted from 21 age. So of course, we have some special license for stores which sell the alcohol beverages, but it's also in maybe rural area. Sometimes this law sometimes doesn't work because of maybe some cultural ideas about, okay, I can send my kids to buy me some alcohol. So it's also in Kazakhstan sometimes exists. Yes.
Okay, so we have quite a number of questions, and the next question is about the community and environmental initiatives that can be helpful. What's your view on this? Yeah.
So from my point of view, community in Kazakhstan is very helpful for more helpful, I think, for drug users, because they have very strong NGOs which help them with some services, with some harm reductions. But for people with alcohol related disorders, we have few NGOs which are very strong. Of course, they provide some maybe not prevention or help in rehabilitation. But environment prevention in our society is not quite popular, because we used to use alcohol in some celebrations, some social occasions with everybody drink alcohol because of celebrations, something. And for example, we have a law which prohibited using alcohol at a workplace. Of course, it's total prohibited, but sometimes it again can be broken by some workers without any maybe punishment.
Okay, thank you. Natalia?
Yes. So I will continue from the previous question that there has been some recent legal reforms, like from 2024, if I'm not mistaken, underage alcohol supply is classified as a misdemeanor criminal offense, and there is a possibility of prosecution. There is the law says that the ID checks by the vendors are mandatory at all points of sale, like kiosks, bars, clubs, supermarkets, every place that sells alcohol, and the ID should confirm that the people have to be 18 years of age and above. There have been tougher penalties as from the environmental point of view. This is why I'm stating this, that there has been tougher penalties that include fines, business shutdowns, and these are being done. And in some cases, when the vendor has repeated this action of providing alcohol to an underage person, there's the permanent license revocation. And from the 1st of July from 2025, if I'm not mistaken, again, sorry, maybe it's 2025 for sure. I think it's the 1st of July, like 2 days ago. The legislation enacted stipulates criminal liability for selling tobacco or alcohol to minors, plus vendor responsibility for ID checks. So the entry to venues is prohibited, and minors cannot enter the entertainment venues unaccompanied, and private events must be registered with authorities. I'm very sure that the registration will never hold, but this is what the law says, because it has been a lot stricter than the laws before. So in terms of offering prevention interventions, the prevention centers, the 75 prevention centers in Greece, globally, Sirius is only one of them. We have another 74. They are doing school-based prevention interventions on that are scientific and culturally adapted to targeting alcohol and addiction prevention. So there are some school-based interventions implemented. The environmental interventions from the government have now been put in practice, so that will help because the research has shown that we have to combine school-based education and community-level policies in order to increase the effectiveness of prevention on access to alcohol and tobacco.
Thank you, Natalia. Yes. Okay, so yeah, let's move on with other questions. We still have a lot of them. I'm not sure if we'll be able to cover all of them today. So, is there a risk that the standard thinking around public health is too numbers oriented, too quantitative, obscuring the deeper human dynamics? What do you think?
Olha, I will have to ask you to repeat. I don't know why I'm not hearing very well. I'm so sorry.
Okay, I'll say louder. Is there a risk that the standard thinking around public health is too numbers oriented, too quantitative, obscuring the deeper human dynamics? Can you? Yeah. Interesting question. Yes. I think you already mentioned about some cultural things. Natalia, you need to unmute your microphone. Yeah.
Sorry. So the question really is that if there is a risk that we're thinking about alcohol dependence.
No, that we are only based on the numbers, I would say. On the numbers.
If we're basing on numbers and not on people dynamics.
And quantitative research, I would say, yes.
Okay.
But if you don't care about deeper human dynamics, maybe qualitative data and so on. So, yeah.
this is a very interesting and growing concern in health and wellness discussions.
Yeah, especially in public health. I agree.
Yes.
Okay, so yeah, would you like to respond?
No, I'm as a point of view, like what I would like to say, but it is my personal opinion, that obviously if we want to see to dive in deeper into the behaviors and into why someone will use alcohol, we need to form a kind of relationship with them, so we can investigate further on norms, um, on behaviors, on thinking, on I can't find the word in English, on normative beliefs. Found it. So obviously, the data, the numerical data, is a way of showing the trend. But if we want to go deeper, I would say that qualitative research is what we are looking for. Also, qualitative research is a lot more um, it costs a lot more, but what we want to see is the trend. You know what we're going to face, and numbers that will help us allocate what are the prevention interventions that we need to do. But better research, in my opinion, is always the qualitative, because we can see other things that are more in depth of what we're looking at.
Yeah, and usually it's a long-lasting research, so it takes lots of time to follow up. Yes, we can't observe any behavioral changes even in a 6 months sometimes, so it needs to be years, yes, to be analyzed, to be included into the analysis. Okay, so this is a question for you as a national chapters, I would say, because ISSUP national chapters are training providers, and the question is substance use disorder training easily accessible to healthcare providers in both countries? Yeah,
I would like to start if you
of course. Yeah,
you
of
don't
course.
mind.
Yes.
So, Republican Center of Mental Health is a provider of UTC and UPC training, because we are a host organization of ISSUP, and we provide trainings and seminars and etc. Educational programs. We create our own educational programs for specialists, and sometimes it depends of regions, because um, when we collect the when we collect data, for example, which region needed to improve their knowledge about maybe alcohol consumption or maybe drug use disorders, we can provide for them specific training on this topic. But in general, we every month provide some regularly trainings for specialists. So of course, we focusing more for our psychiatrists or specialists who work with addictions. But sometimes we can provide some trainings for primary health care specialists, for psychologists, other specialties. So it's really easy to contact with us by email or other options, and we can provide some trainings.
Natalia?
So
Yeah, more about ISSUP Greece.
ISUP Greece, yes, we have ISUP Greece, obviously, and ISUP in general, that offers a lot of training opportunities and webinars where people can get a lot of information. Apart from that, mainly in Greece, for such trainings, apart from serious prevention centers and our prevention centers, we offer training to professionals in order to implement prevention programs. And that would be psychologists, social workers, other professionals that are teachers that work in schools. So we offer that kind of behavior. In terms of us, of professionals being trained on SUDs, There are institutions that offers that kind of training, like university level programs, the continual oh, come on, the programs, there are CME programs through the Greek medical associations, and obviously there used to be, now it's not so. It doesn't offer that many trainings. The new the organization against drugs, the previous organization against drugs, that is now called EOPAE, the institution, the one organization that offers therapy on SUDs. And there are non-governmental organizations that can offer professionals some training, but in reality, trainings for professionals here in Greece have to be paid. They're not offered. We need to search and pay to get trained and get more information. In terms of the prevention centers, we do offer training that is for free for professionals that want to implement prevention programs in schools, the community, in family settings, etc.
Thank you very much. So before we close our event, I would like to use this opportunity to ask how the WHO statement published in the Lancet Public Health in 2023 that no level of alcohol consumption is safe for our health has influenced policies, decision makers, and public attitudes in your countries. So just for the audience awareness, I'll tell the WHO has stated that alcohol is a toxic, psychoactive, and dependence-producing substance. It has been classified as a Group 1 carcinogen by the International Agency for Research on Cancer, and this is the highest risk category that includes substances like asbestos, radiation, and tobacco. Alcohol causes at least 7 types of cancer, including common types such as bowel and female breast cancer. And ethanol causes cancer through biological mechanism as it breaks down in the body. This means that any beverage containing alcohol, regardless of its price or quality, poses a cancer risk. So, moreover, no studies have shown that any potential protective efforts of alcohol on cardiovascular disease or type 2 diabetes reduce the risk of cancer for individual consumers. So, has this statement led to any changes in alcohol policies in your countries?
I think, of course, I agree with this statement, and I more add that recent research shows that even few dosage of alcohol can be a cause of earlier Alzheimer's disease. So for me as a psychiatrist, it's very important to provide this information for our population, because Alzheimer's disease right now is spreading through our society very often. After COVID, we recognize that our cognitive sphere is very weak. And after COVID, we have so many cases of emotional disorders like depressions and cognitive disorders like dementia. And recently we have some increasing diagnosis with Alzheimer's disease. So I don't know how it affects on our legacy and our policy, but pretty sure that we should increase awareness of our population that even small dosage of alcohol can be a cause of very serious consequences. Because maybe 1 decade ago, the cardiologists, they said, so maybe it works with atherosclerosis, etc. But of course, right now, we have strong evidence that there is no any positive effect of alcohol consumption. So right now, Kazakhstan has law for 21 age for alcohol, for permission for alcohol consumption, some license for storage, some penalties for who break this legislation. But we should increase the knowledge of population, because when our society knows about consequences, they maybe can think, and maybe they can stop using alcohol at all.
Yeah, that definitely can influence on their decisions. Thank you. Natalia?
So I want to say that from a preventionist point of view, my issue would be the relationship someone would develop with alcohol rather than the substance itself. And often that relationship lies at the core of the issues surrounding alcohol use and abuse. The way people here in Greece relate to alcohol can be influenced by, are influenced, not can be, they're influenced by cultural norms, the emotional state, social environments, and obviously personal history of each person. But the relationship between a person and alcohol is often more complicated than simply consuming alcohol in moderation or excess. So in Greece, I'm sure that there have not been any significant legal changes directly tied to the WHO's 2023 statement about no level of alcohol consumption, being safe. However, the legislation that has been in practice lately, as you saw, 1st of July 2025, shows a concern in general about alcohol access and alcohol use. But that said, I have to say that Greece's relationship with alcohol is a complex one because it has deep cultural roots, especially in our Mediterranean diets and social life. And as you saw in the research, wine was widely the alcohol of choice. And wine is commonly seen as a staple and integral to both family gatherings and larger public events. So I think that there is an attempt to change the law and make things and make it more strict as a part of an environmental approach to prevention for alcohol use. But directly, I'm sure that there have not. I'm not sure, but I think that directly to that WHO's statement, there have not been any significant changes.
Thank you. So I would like to thank you everyone for participating in our webinar, and a special thank you goes to ISSUP Greece and ISSUP Kazakhstan for hosting this event, to our speakers for their excellent contributions. I would also like to express my gratitude to Kojo Abu for his continuous technical support through today's session, and to my colleague Kirsty for moderating the session. And just a quick reminder that the webinar recording will be available on ISSUP's YouTube channel and on our website. We also warmly invite you all to become ISSUP members if you are not already, so you can join our growing professional community. And you can sign up at www.issup.net. So thank you once again for your time and participation. With so much valuable and expert input shared today, I hope you found the webinar useful to your work. We look forward to seeing you at the next ISSUP event. Thank you.
Thank you, everybody.
Thank you.
Thank you.